How many of you in the audience are organ or tissue donors? How many of you thought about becoming an organ or tissue donor? For those of you that are not familiar with this, an organ or tissue donor is giving an organ or tissue from a living or dead person to a living recipient that is in need of a transplant. These parts are removed in a surgical procedure following the determination of recipient's needs. People of all ages are eligible to be an organ or tissue donor. Prior to anyone becoming a donor, you have to be evaluated on your medical and social history and which organs are suitable to be transplanted. The types of organs that can be used or donated are the lungs, heart, kidneys, intestines, pancreas, and livers. The skin can be donated for the burn victims to provide them with the skin grafts that provides them with a temporary bandage to decrease the pain. The donation of bone is providing patients that require facial reconstruction, correction of birth defects, and oral surgery. Tendons provide them reconstructive surgery and also used for sports injuries. Last but not least, your veins are used for coronary artery bypass surgery patients. Organ donation has several benefits. The organ receiver will have a second chance at life. For the family of the organ donor who recently passed away, you will have the knowledge that the organ of the individual who passed away is saving the life of another person. If a person needs a kidney and you are a match, you can possibly donate the kidney now. There are usually no future problems for those who donate. There are some organs that you can give up all or part of without having any long-term health issues. You can donate a whole kidney or part of the pancreas, intestines, liver, or lung. Your body will compensate for the missing organ or organ part. The pros of being a donor know that you are saving a life of another individual. The cons are that being an organ donor, it is a major surgery. It will take some time for you to recover from the surgery. There are certain groups that are against organ donations on religious grounds, such as the Roma, which are gypsies. It has raised some concerns with ethical groups due to the use of cloning to produce organs with identical genes to the recipient. Another discussion is the use of animals' organs for humans. Such use is the pig organs for human use. This supply is promising, but with the animal rights groups against the sacrifice of the animal for the organ donation has launched campaigns to ban them. I am sure many of you have heard of the black market for the organs. The black market is occurring in different countries. Those who have money to pay for the organ will receive it prior to those whom are on the list waiting for the transplant. In fact, organ selling is legally banned in India. How many of you have heard of a person being brain dead? Well, brain dead may result in a legal death, but still with a heartbeat with mechanical ventilation, all the organs are kept alive. Most of the organ donation for transplant is done in the onset of the brain dead. The last thing that I want to talk with you about is how the organs are distributed within the country. The United Network for Organ Sharing and the Organ Transplant Network deals with the ethics and standards. The lungs are based on the recipient's lung allocation score and is determined based on the urgency and wait time. Livers use both statuses systems, and pancreas lists are based on location and blood type. Remember, the hearts and lungs need to be transplanted within 4 to 6 hours from recovery, liver about 8 to 10 hours, and pancreas about 15 hours. If the kidneys are packed on ice, they can be successfully transplanted 24 to 36 hours after recovery. Please, everyone needs to be an organ donor. You will never know if a family member of yours finds out that they need to be placed on the waiting list, and all of the ups and downs that the recipients go through in finding a perfect match. To become a donor, you are saving another person's life or life of a family member.